Hi everybody, all you nursing students or nurses to be or students to be, happy holidays. I have finished my third semester. I'm on holiday break and I have one more semester and I'm done. So I thought I would let you know what I did this semester and give you a couple of pointers and see how you're doing, and so you know I'm still alive. I had labor and delivery for 8 weeks. It was great. We learned a lot about inducing labor, cesarean versus vaginal deliveries, and fetal heart rate monitoring, and how to recognize fetal distress and what to do about it, and nutrition for pregnancy, and postpartum care of mom, baby, dad, family, or just mom, baby. I saw that too. It was great. I liked assessing the babies, and I learned a lot. Wow, because I really didn't know much about pregnancy. So it was a lot of information. I loved it. My instructor was great, and I did my whole rotation at one hospital. I'm trying to think if I did any community stuff. No, I did not. So then I finished my pharmacology for the whole program, so I'm done with that. I know a lot of different drugs and what they do and what to watch for, and so I still use my app on my phone though. Get the app on your phone if you can, the drug book app. What drug book? I use Nursing Drug Handbook. Whatever you can get, they're all good. Just make sure they're professional for medical. Anyway, then I just finished Psychiatric, 8 weeks of that, which also included elder care, which I love. I love elderly. And I also want to mention a documentary that I saw that I think you all should watch. It's called Alive Inside, ALIVE, and then Inside, INSIDE .US is the website. You can see the documentary on Netflix, or you can download it onto your iTunes. And I saw it in a theater, and it is how music touches people with dementia, Alzheimer's, and the elderly. And you must watch it. I think it's only an hour and a half. It will change your thinking as far as music and brain activity. I won't tell you anymore. I'm not going to spoil it. Please watch it. Alive Inside. I'll put a note on my video. So anyway, Psychiatric. I did my rotation at a hospital, and outpatient and inpatient. I learned a lot about adult, adolescent, child, and chemical dependency. And we covered depression, bipolar disorders, schizophrenia, psychosis, the drugs to treat all those disorders, and chemical dependency, and the drugs that help with detox and relapse, and how to communicate. And it helped me so much in my everyday life. I'm a better listener now, and I feel like I can hear people in a different way, and I can use therapeutic communication with my patients, because really we're treating the whole person, not just the disease. But and mental illness is a disease. If you have bipolar disorder, it's the same thing as if you had diabetes or high blood pressure or heart disease. It's all disease, and it's basically based on the neurotransmitters in our brains, that they're out of balance. There's a lot of drugs being used, and again, that might rub you wrong. It kind of rubbed me a little wrong, but then again, you have to think about, how do we balance those neurotransmitters without using medication? Of course, there's exercise and diet and things like that. But some people, their transmitters, their receptors, there's anatomical differences in their brain are so off whack, whacked out, just like your blood sugar gets whacked out or your blood pressure, that they have to use medications to try and get those numbers back to normal. But again, watch Alive Inside, the documentary about music therapy, and use it with your patients. Okay, let's see. So I finished psych, and it makes better nurses if you know how to communicate and listen and evaluate not only verbal signs but nonverbal signs, and also it'll teach you how to recognize diseases, mental disorders or mental diseases in a patient who's maybe come in with a broken leg, and you might say, oh man, this person seems depressed too, or oh, they're having some psychosis, or they sound like they might need an assessment for bipolar disorder. So anyway, it helps you to recognize signs and symptoms of mental disease, and so you can better help your patient as a whole person. I can't say enough about psych. It was great. Super important. So, see, what else did I learn? The drug book's great to have. And so, okay, so next semester I have cardiac for 8 weeks, which includes ER and burn unit and cardiac rehab. And then my last 8 weeks is when I do my preceptorship, where I work with a registered nurse on their shift at a hospital that will be selected for me. I'll find out in February, and I'll do 120 hours in 8 weeks, which isn't a lot, but I get to use what I've learned. So that's going to be where I'm actually working as a nurse. And as scary as it sounds right now, I think I'll be all right. I just need to make sure I take care of me. I'm not exercising enough, so I'm trying to walk more on my break here. I've got 5 weeks off, and it's hard to go from 100 miles an hour to 0, so I'm having a little bit of a hard time relaxing. But I'm thinking by the end of the holiday, I'll be pretty mellowed out and ready to hit the road running. What else? What else can I say to you guys? Hey, I'm really proud of all of you wherever you are on your journey, and be good to yourself, especially when you're having a rough time. It may be in your personal life or with your studies. Just be really kind to yourself, and don't beat yourself up about too much. It doesn't help, right? And find support where you can, and and learn your lab values. Do you think I'd know my lab values by now? Look at this card. Look at this card. It's stuck on my desk. Well, you can't even see it. See it? It's backwards, but lab values. I gotta get those down, man. Calcium, magnesium, potassium. That's and everything. I had some good sim labs too, simulation labs, when we did overdose and with bipolar depression, because a lot of people who attempt suicide by overdose have depression. Duh, yeah. So that was a good sim. What else? Boy, I feel a little just kind of buzzy right now, like I'm not here. Trying to get in the holiday mood, right? Okay, so write me, ask me questions, email me, barbthenurse@gmail.com. And I am so proud of you guys. I can't say it enough. You're awesome. I'm rooting for you. I know you're out there rooting for me, and I'm almost there. And the anxiety of that, I'm not going to make it kind of thing, is gone. I'm going to get through this program with flying colors. I'm actually graduating with honors. Could you believe it? I know. So I'm going to give you my best Who face if you watch The Grinch That Stole Christmas. Okay, ready?